we do have Michelle Campbell, who is one of the creators of this, on as well. So I know Epi said that they were going to come in, as well as some of the other folks who were involved in developing this. So I'll present, but at the end of this, we'll have a Q&A session, and hopefully we'll have some people who are here from the development of it to also give some insights. But so basically the goal of today is to discuss the Meditech PUI form updates. So now, since February 1st, we've had the ability to do PUI forms, to enter PUI forms on Meditech. Some health stations have adopted it, some haven't, some have been waiting for the training. So the objective of today is to basically go through, you know, what are these forms, why do we have these forms, and how to enter them. So by the end of this presentation, the learner will have reviewed the components of the PUI, view examples of the new Meditech fillable PUI, complete case studies using the COVID-19 protocol version 6, which is the version that we're still actively using. And we will review a couple of common questions that people have, not just around PUIs, but the electronic PUIs, but the process of doing electronic PUIs. Is everybody okay to see the screen? Excellent. Okay. Joanne, I'm like looking at you, shaking your head. You're my sort of go-to video. For folks who don't know me, my name is Abby Mahan. I am the clinical nurse educator currently working out of the Kitikmeot. So I'm coming to you from Cambridge Bay. You may have seen my face posting on Nunavut Nurses Education from time to time. So I'm presenting this today, but this was actually put together by two public health nurses who work out of Igloolik, Kristen Williams and Michelle Campbell. Kristen, I think, is still out doing mass vaccination clinics right now. So I'm presenting this on their behalf, but they really did a phenomenal job putting that together. So I want to give full credit where credit's due. So this may look familiar to everybody. So as of February 1st, we've been transitioning from the original person under investigation forms for COVID-19 tracking to a Meditech version. So this is just sort of your old form. It was a 2-page document with all of the different components that we required. And this is the overview of the Meditech generated PUI form. So when it prints out, it looks a little bit different, but it does follow the same sort of organization and pattern that the original PUI form follows. So if you were comfortable using that PUI form, there shouldn't be too many surprises coming out of the Meditech version of it. However, there are some nuances that people need to get comfortable with because it can be a bit frustrating when you start getting used to entering the Meditech version. So just as a little refresher, you know, the PUI form can be found in Appendix D, or sorry, the algorithm that we use to determine whether somebody needs a PUI form can be found in Appendix D of the COVID-19 Public Health Protocol. So starting off with the form, one of the common things that we get back, one of the common types of feedback that we get back from pretty much anybody who's involved in contact tracing, in swabbing, in any sort of follow-up from the PUIs, is that the identifiers are incredibly important. So identifiers need to be complete, they need to be as thorough as possible, and they need to be up to date. So that would include their name, the person that's actually giving the information, as well as the address, the community at the time of the assessment, the phone number, and if they don't have a phone number, you can put no phone, but a way to contact them in the notes is very helpful, and also the house number. So again, you can see here, you can put community at time of assessment. It's a drop-down menu, and then the phone number and the house number at the time of the assessment you can just put in there. Okay, and then there's a section on exposure risk. So this is extremely important information and must be completed as thoroughly and accurately as possible, and ask about all recent travel history. So we're looking at travel history outside of territory, but also within territory. When it happened, did they stay in a hub? Did they have any contact with someone that they have known exposure with, risk with, known exposure with? So again, it follows very closely with the paper PUIs. So travel-related exposure risk, there's a drop-down menu for that one. The return to the community date, provinces, cities, and Nunavut communities that were visited and what dates they were visited. If they had to go through a hub, what was the location? Was it the Edmonton, the Winnipeg, or the Ottawa hub? Any contact-related exposure risk, name or details of if they were in contact with a known case, the date of last contact, and then any details. So, you know, how long were they in contact with this person? Was there any PUI used? Was there social distancing used? All of that information is really important to gather and really, really helps the folks who have to follow up on these forms. So again, contact-related exposure risk. So ask if they've had contact with the confirmed COVID-19 case, the date of the most recent contact, and if they've had contact, we want to specify if this is a high, medium, or low risk contact, and try to gather as much detail as you can. And of course, if there is any question or confusion about whether or not someone is a high, medium, or low risk, you can always get in touch with RCDC, or if you do have the rapid response team in your community, those are also good resources to use. So just a quick review on what constitutes a high-risk exposure. So someone, for example, who has provided direct care for the case without consistent and appropriate use of personal protective equipment, or a household member who had other close physical contact with the case without consistent and appropriate use of recommended PPE. A person who's lived with or had other close prolonged contact within 2 meters of a case, while the case was up to 48 hours prior to symptom onset, right? So we always think about infectability, or rather infectiousness, as being 48 hours before symptom onset and then up to 10 days afterwards, or while the case was symptomatic and not isolating. And of course, people who've been in direct contact with infectious bodily fluids of a case. So someone who has coughed or sneezed on. Medium risk exposure would be someone who has provided direct care for the case or who had other similar close physical contact with consistent and appropriate use of PPE, or who had lived or otherwise had prolonged contact but was not within 2 meters of a case up to 48 hours prior to symptom onset or while the case was symptomatic and not isolating. And then a low risk exposure would be someone who had only a transient interaction. So someone who had just walked by the person, you know, was briefly in the same room. Okay, so moving on to symptoms. You want to make sure that you're documenting all symptoms. If they're not listed under the electronic PUI form, you can just put other. If folks do have GI symptoms, stomach upset, nausea, vomiting, anything of that nature, describe it. And routine testing of asymptomatic individuals is not routinely recommended. Testing of asymptomatic individuals, you know, contacts or any sort of cluster investigations that might be being done will be done under the guidance of the public health officer in specific investigations or surveillance purposes. And if you are doing a PUI because you were advised by the PHO or someone else to do a swab of an asymptomatic contact, it's important to put in your notes, or rather in the PUI form, the rationale for the asymptomatic testing. And of course, ask and document when the symptoms first began. So after that, you're going to go into a drop-down menu for isolation. So there's a little typo here, but it'll go under the mnemonic IUF for isolation under the guidance of the RCDC. IUS is isolate until symptoms resolve, or no isolation indicated, NII. And of course, if, you know, just as a reminder for everybody, if no isolation is indicated, that would be a moment also to provide some education as well around social distancing, around maintaining, you know, good hand hygiene. Okay, and then additional details. So again, very important for folks who are doing the follow-up, who are doing the contact tracing, who are calling and checking in with people. You want to know the number of folks that are in the household, whether the person is a healthcare provider, and again, these are all drop-down menus, the place of work, so where do they work, and specify their occupation. Okay, so this is just kind of, and I will put the slides up so that people can have sort of a step-by-step guide on how to go through this. But the steps to formulate a Meditech PUI. So when you're opening up Meditech, you're going to go and, you know, you'll go into patient information, find patient, select the patient, select the visit. Then you're going to select orders. So it's not under documents, it's under orders. Go to new orders. And then select categories groups and go under COVID-19 PUI assessment form and click next. And then the manage edit order list will appear. So fill in all the appropriate details. And this actually happened to me the first time I tried to enter a PUI into Meditech. You'll notice that if you haven't filled out all of the information, including no to things like asymptomatic, it's going to give you a red asterisk when you try to actually save the order. So make sure that you've gone through and you've filled in all of the mandatory fields. And of course, a mandatory field would be indicated by an asterisk next to the descriptor of the box. Okay, so from there you would click submit on the bottom right corner when finished and then hit save. So the PUI will automatically be sent to RCDC and the Communicable Disease Epidemiology team. And it will automatically print out from your printer so that it can be given to the appropriate person following up with the PUIs. So this is a little bit of a different process from what we're used to. So, you know, with the paper PUIs, we would do the PUI, scan it, or if it was already an electronic PUI, we would have it on the computer, and then we would send it to the regional CDC, and oftentimes the public health nurse, or, you know, whatever has sort of been organized at the community level. So in this case, ostensibly, you don't need to email anybody. However, anecdotally, when I was working in a community recently, it doesn't always print out, or the person is not always aware that it's being printed out. So, you know, making sure that you're going and actually advising whoever is doing the contact tracing or the following up with this particular case or with this PUI actually knows that this is going to give them the paper, and just check in with them to make sure that they actually know that that this paper is on their desk. The other thing that was given to us as feedback was that oftentimes when the RCDC gets this, they're looking at this in a stack of them, and the date that the swab happened. So for example, if you actually had tested the person, it doesn't necessarily print out on the sheet. So, you know, at the health center, if you're very busy, sometimes you put off documenting for a little while. It's important in your notes to indicate if you have swabbed or at what time the PUI was done, exactly the time that it happened, because RCDC will only actually be able to see the time that the note was printed out, or rather the order was printed. So there's no indication of when it started. There's no timestamp for when the test was actually done. So just make sure when you're detailing what actually happened with that PUI form and with the swabbing, make sure you detail it in your additional notes so everybody can be aware of when the swab was done. So then, in order to view a completed PUI order, select the visit that the PUI was completed under, press Orders. In the order screen, select History. And then you'll find the COVID-19 PUI under Referral Public Health. And you can view the detailed form. And it will automatically print, but if you do need to print it again, you can print it off of this. So just some important things to remember. Version 6 of the Communicable Disease Manual COVID-19 protocol remains in effect. It's available here, and of course, with Teams, it's available on Nunavut Nurses Education under the files part of the COVID-19 channel. For any communities that have a COVID-19 outbreak, the direction and guidance of the outbreak team, the PHO lead, and the existing workflows supersede any guidance in this presentation. And healthcare providers who order and perform COVID-19 testing are required to send a completed PUI investigation and assessment form to the RCDC and CD surveillance by email or via the Meditech form. So that was just sort of a reminder of what we talked about before. So if you, there is always the option of using the paper form, you know, if Meditech is down. But in that case, then the obligation to send it to RCDC and CD surveillance, and ideally CC whoever is managing that at your community health center level by email still applies. We are really trying to encourage folks to move towards the Meditech form. It's much easier to gather data. It's much easier to kind of trace things. It's more centralized. But recognizing the realities in which we all work, there are times that you have to use the paper form, and in that case, then the old procedure applies. Okay, so Michelle and Kristen put together some common questions that folks might have, and you guys can answer this. How do I determine the contact-related exposure risk? So how does one determine the contact-related exposure risk? Any ideas? Okay, well, so contacts of a probable or confirmed COVID-19 case are assessed based on high, so close contact, medium casual contact, and low transient contact level of risk. So another question is, how do I determine the isolation category? And PUI should remain in isolation until advised otherwise by a healthcare professional. PUIs who have more acute symptoms, so cough or fever, or an identified exposure risk require RCDC clearance to be removed from isolation. PUIs who have mild symptoms and no identified exposure risk may be removed from isolation by a healthcare provider once their symptoms are resolved. And if symptoms increase or worsen, or there are any further concerns, the PUI should remain in isolation and the healthcare provider should consult RCDC. So another common question, where should I put additional information such as the need for a translator or a caregiver's name? And you can put that at the bottom of the Meditech order form. There's in the additional notes. Is this Meditech PUI form available to be used now? And the answer is yes. Meditech PUI form went live on February 1st, 2021, and is available to be used now. And what is the purpose of transitioning from the original PUI to the Meditech PUI form? So as we mentioned, this new form, it's intended to improve data accuracy and the reporting process, as well as a streamlined effort for all those involved. So any questions so far? before we dip into some case studies? Oh, we're all good? Okay, so Joe C. calls the clinic and tells you that he has a new cough that has been getting worse over the last 2 days. He's also feeling achy and tired, but he denies other COVID-19 symptoms. Excuse me. Do you need to fill out a PUI for Joe? You guys can just type your answers in the meeting chat. Joanne, you're muted, but I think you said yeah. Okay, so correct, yes. And Michelle said yes, excellent, awesome. So yes, you do need to fill out a PUI for Joe. When should you fill it out? Is it necessary for you know, someone to call them back, or do they have to come into the health center? Maybe we'll just put all of these out there. What further information, if any, do you need to fill out a PUI form? Does he need to have a COVID swab? And does he need to come to the clinic for an assessment? So Joe C calls the clinic and he's got these symptoms. What are we doing? I'm sure for a lot of folks who are working in communities, a lot of this is old hat. Oh, Joanne has her hand up. Yes.
Yeah, he'd come to the clinic for an assessment, and he would need a COVID swab according to our flow chart.
Definitely needs a COVID swab. Doesn't necessarily need to come to the clinic. So in this particular case, unless he's got you know, any indications of respiratory distress or any reason why he would need to see the nurse on call, doesn't necessarily need to, but 100% right. Excellent instincts. So we can actually start filling out the PUI on the phone. Doesn't necessarily need to go into the health center, but we can get all of this information with him on the phone. We definitely do, as Joanne said, need a swab, and we can send the team out to go and make sure that he gets that swab and that they have the appropriate PPE while they're doing it. And of course, it would be following the PPE guidelines for droplet precautions. So, case study number 2. Mary Kay calls and tells you that her sister tested positive for COVID-19 today. Mary was in the same vehicle with her sister 3 days ago, and they were not wearing masks. She wants to know if she needs to be tested and if she should come to the health center. Mary has no symptoms. So, do you need to fill out a PUI for Mary? And if so, do you need any more information? Does Mary need to be swabbed? And should Mary be isolating? Any thoughts from the group? I won't pick on people on a Wednesday morning. I'm not that mean. Okay.
Has she not had? Oh, sorry.
Oh no, go right ahead.
Not, it all determines within this car whether she was medium risk or high risk. No. Exactly. I mean, there's no testing indicated. She's in a car with a positive case. So does that make her high risk or does that make her medium low?
It's a very good question. So we think about some of the stuff that would advise that, right? So if it was just sort of a passing interaction, right, and she just kind of like jumped in, jumped out, that would be more of a low risk. If she was staying there for an extended period of time, you know, or if it was a repeated interaction, we would put her more at a medium risk. So you would definitely need to fill out a PUI for Mary. You need information about how long Mary was in the car, as we spoke about, with her sister, and whether there was any other time that they were in contact. So you need information to determine, like Joanne correctly said, whether she's a low, medium, or high risk. In this case, you could have a talk with RCDC, right, and sort of figure out, we'll put her at the medium risk category, just for, you know, if she's staying in the car for a bit of time, it's likely that she's not a low risk. Doesn't necessarily need to go to the health center, doesn't need to be swabbed, but she does need to self-monitor and socially distance herself, and needs to be instructed to contact the nurse if any symptoms develop in the next 14 days. And again, this will be superseded by any directions that are given to you if there is community spread. And in that case, you would follow the direction of the PHO, RCDC, and whoever the team lead is in your community. Okay, so case study 3, Nevi brought her 2-year-old daughter Arlene to the clinic to be assessed for a cough, runny nose, and fever that started 2 days ago. No one else in the household has any symptoms. So does Arlene need to have a PUI form filled out? Do you need more information? Does she need to be swabbed? And does Arlene need to have a PUI form filled out? And does Nevi need to have a PUI form filled out or be swabbed? So I think we've seen this, you know, definitely we're in the midst of, we're still in the midst of RESP season on any sort of year. So, you know, we get a lot of coughs and runny noses from 2-year-olds coming in. I think this is just a reality that we're all very used to in the health centers. Oh, Joanne has her hand up. Yes.
Well, yes, Arlene would have to get tested.
Correct. And what about Mom?
I'm not so sure. I don't know. I mean, that's pretty close contact because she's only 2 years old. So there would be pretty intimate contact. I'm assuming she would, but I honestly don't know.
Totally fair. So in this case, anybody else have, I should open it up. Anybody else have any other additions or building on what Joanne said? Okay, so as Joanne rightly said, so Arlene does need to have a PUI form filled out. You want to know, of course, you know, has she had any out of territory travel, or if she's been in any sort of community that is known for community spread? Has she had any contact related exposure risk? You want to ask about any other symptoms. So Arlene would be swabbed. We could put Mom's name in additional notes. Don't necessarily need to do a PUI for Mom at this point. However, really good, thorough teaching to tell Mom, first of all, around social distancing, around hand hygiene, around respiratory hygiene, but also making sure that if she does get symptomatic, even if sort of light symptoms, that she calls the health center and we make sure that someone goes out and tests them. So if anybody requires further information, you can contact your RCDC. So these are just the regional the RCDC contacts that are available. So are there any questions at all? I know for the most part, filling out PUIs has been kind of old hat, but you know, it does require a fair amount of, you know, all these cases are oftentimes very complex. Contacts are a dynamic thing. Has anybody actually used this so far in their clinic? I think that's, Joanne, how has your experience been using this so far?
It was fine. The only difficulty I had was I couldn't understand why it kept giving me the edit. And it was because I only filled out the symptoms that applied. I didn't go no to all of them. So once I went back and did it again and did that, then it accepted it. But that was the only challenge.
I would say I had exactly the same problem when I first entered it, when I did it the first time. Anybody else that's on the call used it or has any sort of questions or comments around? It's about a month since it's gone live, so some people have been able to use it a few times over. Oh, and I see someone is there. Folks are typing here. Emil says the form is very straightforward. Okay, that's excellent. And we'll just. I think a lot of folks don't have microphones, so we'll just give a little time to. All right, Karen Kinzel says no problem so far. A few more folks typing. Oh, Emil says, also when ordering the PUI form on Meditech, I was told to select within scope of practice. Okay, interesting. I don't know if that's something that the CHINs or the public health nurses have encountered. Has anybody else had to put that?
Hi, Abby. No, I've never seen that happen before. I know that there is a couple ways to order the PUI on Meditech, and if you do orders and then just do name and start typing in COVID, it'll go that way as well, rather than to go through the public health referral option.
Okay, gotcha. And Crystal is asking, has there been any feedback about date and time of swab not entered into the Meditech form? Yeah, so Crystal, this was actually feedback that I had gotten from our CDC here, was that they are having some challenges determining, when the swab was done. So, one of the issues that we have seen is that when the PUI is really a snapshot of what happened at that particular time and that particular clinical encounter, so there's no way to kind of go back and amend it, at least in the main form. But also, understanding the general workflow of a lot of community health centers, as much as we try to encourage, same time contemporaneous charting, sometimes PUI forms do get put off till the end of the day, so we wouldn't necessarily have an accurate timestamp of when the swab was done. So that was the feedback that we got from our CDC, was that it's always very helpful to try and be as detailed as possible in the additional information around, time the swab was done, things of that nature. Does that answer your question, Crystal? Or does anybody else have any feedback about the date and time of the swab not entered into Meditech? I know we've got a few public health nurses on. I'm not sure Michelle or Eileen or anybody else who's involved in this.
No, exactly like you said, Abby. If the swab was done at a different time, you can just put that in the additional notes section.
Wonderful. Okay, and Crystal says, yes, I was just wondering about this because it is prompted on the physical form. Yes, yeah. Yeah, true enough, Crystal, this was actually some feedback that we've been given, right? Because the additional notes does carry a lot on its shoulders. You know, we're sort of anything that doesn't fall within the drop-down menus really should be included within there. So it is important that people are aware to write the time of the swab. And I see that Eileen is typing. Eileen says, I used to do the PUI through paper form. Oh, and Emil is currently our COVID public health nurse. Okay. Yeah, I think a lot of folks are sort of in the process of transitioning from the paper PUI. Okay, so just some resources that are available for folks. So of course, the version 6 COVID protocol, it's the same version that we were using over the course of the fall and the winter so far. There is, if folks are relatively new to the territory or they're not as comfortable with the protocol, maybe they're, you know, they haven't been able to do any of the mandatory trainings that are involved. You can always go to, there's a couple of places, it's all over Nunavut Nurses Education. So there is a COVID-19 channel. So we have the Nunavut Nurses Education team, and then the sort of subgroups are called channels. And within that channel, you can access the COVID-19 protocol version 6 under files. If you're interested in the training on it, it's also there for you. And of course, you can get it in the internet on the communicable disease binder. There is also the PUI assessment form tip sheet that I'll make sure is up for you. It's been up in February, but I'll just put everything in a file. So this recording, the PowerPoint forms, the PUI assessment form tip sheet, you know, and any other documentation that's helpful. And of course, there's the public health memo, the COVID-19 PUI form on Meditech that went out around the same time that we launched. So a disclaimer, this PowerPoint was created by Michelle Campbell, who's with us, and Kristen Williams, Igloolik Public Health Nurses, on February 22nd, 2021. The information is up to date as of the date of distribution, and information regarding COVID-19 is rapidly changing, as we all know. So it falls upon us to ensure that we have the most up-to-date policies. So if you are watching this at a later date, just to be aware, to be cognizant that you know, some of this, particularly the algorithms on who needs to be monitored and whatnot, may change. So it's always important to make sure that you're considering that. Okay. So that is all from me. Are there any other questions around PUIs, around even accessing some of this training in Teams, or anything else before we move out? Okay, so that is the presentation on electronic PUI forms. I will have, like I said, in the COVID-19 channel, I will have all of this up, so you can just sort of tell your colleagues that if they have any problems with PUIs, they can feel free to watch this. And also, it will be posted in the COVID-19 training on the wiki under the general channel of Nunavut Nurses Education. So if you look at training and resources, it's sort of a mini Wikipedia for Nunavut Nurses Education that we're building. Thank you so much for coming, and please feel free to get in touch if you have any other questions or concerns. Have a great day.
Thanks, Abby.